Thank you again for coming. Our next delegation is Dr. Ronald Scott. Sir, if you'd like to come forward, and please give us your address, and you have about 8 minutes. And I'm advised by the clerk that all the presentations that we're seeing on the screen tonight are being presented exactly as provided to us.
My name is Ronald Scott. I'm a second-generation Brantford dentist. Address 172 Morale Street, Brantford. Mr. Chair, Mr. Mayor, Councillors, I would like to take this opportunity to present the International Academy of Oral Medicine and Toxicology's position on fluoride and fluoridation. The history and mission of our organization is presented on page 1 of the books that you were presented. The fundamental mission of the International Academy of Oral Medicine and Toxicology is to promote the health of the public at large. Essentially, the Academy shall continually examine and compile scientific research relating to the biocompatibility of oral/dental materials. This agenda should ensure a more informed use of these materials in clinical practice. Within these confines, the Academy shall, and I'll highlight 2, accumulate and disseminate scientific information and promote education of the public, professional organizations, and other groups by providing scientific information. The discussion of fluoride and fluoridation over the last 50 years by the general public or casual observer have often been complicated by the lack of discernment regarding the difference between effects caused by systemic exposure and topical applications. Scientific discussions have been further complicated by providing undue weight to claims of effectiveness that have resulted in the abandonment of margins of safety that are essential to any toxicological profile and establishment of public policy. In the IAOMT's ongoing examination of the toxicological data on fluoride, the Academy has made several preliminary determinations over the last 18 years, each concluding that fluoride added to the public water supply or prescribed as controlled dose supplements deliver no discernible health benefit and cause a higher incidence of adverse health effects. This current policy position by the IOMT confirms those earlier assessments and asserts that there is no discernible health benefit derived from ingested fluoride and that the preponderance of evidence shows that ingested fluoride in dosages now prevalent in public exposure aggravate existing illnesses and cause a greater incidence of adverse health effects. Ingested fluoride is hereby recognized as unsafe and ineffective for the purpose of reducing tooth decay. Safety and adverse health effects. And if anybody's following along in your binder, it's page 4. In a request for more information on ingested fluoride, the Academy sought the input from both sides of the fluoridation issue and ultimately heard from more than 13 different experts, both in favor and opposed to fluoridation, and in 1998 conducted an extensive scientific risk assessment on the health effects of ingested fluoride. This conference resulted in the publication of a public health goal in the journal Fluoride, which applied standard U.S. EPA protocols to current studies. The risk assessment used 4 studies where daily dose could be calculated and applied to the standard EPA Global 86 program to establish the minimum risk level of 0.0001 milligram per liter for ingested fluoride. This level is well below our current exposure levels and should be of concern to everyone. Furthermore, otherwise unaware members of the IOMT were shocked to learn that the chemical widely used in the artificial fluoridation schemes is untreated hydrofluorosilicic acid waste from the phosphate fertilizer mining industry that has not been tested, much less been proven safe. This product, along with its salt, used in the 91% of the fluoridation schemes, contains numerous contaminants, including arsenic and lead, that have been never factored into any risk assessment. It is the position of the Academy that from a toxicological point of view, fluoride proposes unacceptable health risks. The IOMT has determined that fluoride is not an approved dental material and should not be taken internally. Public health goal for ingested fluoride. The International Academy of Oral Medicine and Toxicology has received input for this public health goal from more than a dozen sources and co-hosted scientific symposium on the health effects of ingested fluoride as a final step in developing this public health goal. Adverse health effects demonstrated were fluorosis, cancers, genetic damage, bone pathology, transplacental and brain transport, histological brain, artery, and kidney damage, and neurologic impairment. One of the most susceptible populations would be infants fed entirely tap water-based formula or home-prepared vegetables, rice, or other water-absorbing foods. Infants fed baby food, such as mechanically deboned chicken, who have impaired renal function or diabetes with poor fluid retention are at great risk. It is well established fact that dental fluorosis is linked to the combination of fluoride in the water and the absence of breast milk. Human breast milk usually contains less than 0.01 part per million fluoride. Fluoridated tap water therefore contains, and this is American standard of 1 part per million, 100 times more fluoride than breast milk. When a baby is fed infant formula mixed with tap water, it receives a daily dose 100 times greater than the infant on breast milk. Page 30, fluoride risks. People want to know the science. These are the risks that have been identified in scientific reviewed studies. Risk number 1, fluoridation is cancer-causing, cancer-promoting, and is linked to increased cancer rates in rats, mice, and humans. Risk 2, hip fracture rates are substantially higher in people residing in fluoridated communities. Risk 3, dental fluorosis, the first visible sign of fluoride poisoning, affects from 8 to 51% of the children drinking fluoridated water and has substantially increased over the last 40 years. Risk 4, all of the recent large-scale studies on fluoridation and tooth decay that show that fluoridation does not reduce tooth decay. Risk 6, fluoride exposure and dental fluorosis are linked to lower IQ and neurologic impairment. The history of fluoride is very simple. 65 years ago, fluoride was added without public consent, and the citizens of Brantford were informed on September 26, 1945, of this experiment. 65 years later, the results of this experiment are in. Ingested fluoride has no dental benefit, but ingested fluoride is shown in scientific studies of causing adverse health effects. What are we as dentists to do? We supported the experiment. What, as city councilors, are you to do? You signed off on the experiment. And what are the city engineers to do? You are still adding the toxic element fluoride to city water. The answer is simple. Stop the experiment. Turn off the fluoride. If you will not turn off the fluoride, then supply all families with children under 2 years of age with fluoride-free city water. Thank you for your attention.
Dr. Scott, thank you very much for your presentation. We are out of time.
I'm not part of a delegation that goes from council to council. This is my first presentation.
Thank you.